When we consider implant dentistry, essentially the implant's replacing a tooth root. And the tooth root used to be in bone. So when the tooth is lost, we lose bone. That's in all ways. If the tissue and the hard supporting the bone around it is deficient, then that has to be regrown. So we generally call that a graft. So we may have bone grafting that's required, or simply soft tissue procedures which kind of make it look nicer. The timeline or scenario for somebody that's wanting implant dentistry or other complex restorative work would involve the consultation, which is complimentary, and then we kind of explain a general format for treatment, and then the financial arrangements, because in our practice we don't do any treatment whatsoever until everything's explained, how much things will cost, how they're going to be taken care of, so that it relieves the stress level for the patient. I want to get to know you as a person as well as your mouth, because your mouth I can look into and I know what's going on. But everybody brings their own anxiety, their own story, and the relationship's always very casual and slow, so that if there's any questions, we want them answered. Once we begin treatment, then it flows pretty quickly and according to the plan. It's really stress-free, and it's kind of exciting for myself and the patient.